The basic structural and functional unit of the human body is? The answer is C. Cell. The largest organ of the human body is? The answer is B. Skin. The powerhouse of the cell is? The answer is C. Mitochondria. The control center of the cell is? Answer is A. Nucleus. The organelle responsible for protein synthesis is? The answer is B. Ribosome. The cell membrane is primarily composed of? The answer is B. Lipids and proteins. The longest bone in the human body is? The answer is C. Femur bone. The smallest bone in the human body is? The answer is B. Stapes. The number of bones in an adult human body is? The answer is A. 206. The number of pairs of ribs in human is? The answer is C. 12 pairs. The number of cervical vertebrae is? The answer is B. 7. The first cervical vertebra is called? The answer is B. Atlas. The second cervical vertebra is called? Answer is B. Axis. The shoulder blade is called? The answer is B. Scapula. The collarbone is called? The answer is B. Clavicle. The kneecap is called? The answer is C. Patella. The functional unit of the kidney is? The answer is B. Nephron. The functional unit of the nervous system is? The answer is B. Neuron. The functional unit of skeletal muscle is? The answer is B. Sarcomere. The functional unit of the lung is? The answer is B. Alveolus. The normal resting rate in an adult is approximately? The answer is B. 60 to 100 beats per minute. The human heart has? The answer is C. 4 chambers. The natural pacemaker of the heart is? The answer is B. SA node. The SA node is located in the? The answer is B. Right atrium. The AV node is located in the? The answer is A. Right atrium. The largest artery in the body is? The answer is B. Aorta. The largest vein in the body is? The answer is C. Inferior vena cava. The pulmonary artery carries? The answer is B. Deoxygenated blood. The pulmonary vein carries? The answer is B. Oxygenated blood. The valve between the left atrium and the left ventricle is? The answer is B. Mitral valve. The valve between the right atrium and the right ventricle is? The answer is C. Tricuspid valve. The normal adult blood pressure is approximately? The answer is C. 120 over 80 mmHg. The instrument used to measure blood pressure is? The answer is B. Sphygmomanometer. The first heart sound is mainly due to closure of? AB valves. The second heart sound is mainly due to closure of. The answer is B. Semilunar valves. The normal pacemaker rate of the SA node is approximately. The answer is C. 60 to 100 beats per minute. Which blood vessel normally has the highest blood pressure? The answer is C. Aorta. Exchange of gases and nutrients mainly occurs through. The answer is C. Capillaries. The blood supply to the heart muscle is provided by. The answer is B. Coronary arteries. The average lifespan of an RBC is. The answer is D. 120 days. The main organ of respiration is. The answer is B. Lung. The normal respiratory rate in an adult is approximately. The answer is B. 12 to 20 per minute. The windpipe is called. The answer is B. Trachea. The voice box is called. Answer is B. Larynx. The flap that prevents food from entering the trachea is. Epiglottis. Gas exchange occurs mainly in the. The answer is C. Alveoli. The main muscle of inspiration is. The answer is B. Diaphragm. The right lung has. The answer is C. 3 lobes. The left lung has. The answer is B. 2 lobes. The respiratory center is primarily located in the. The answer is B. Medulla and pons. Most oxygen in blood is transported by. The answer is B. Hemoglobin. Most carbon dioxide is transported in blood as. The answer is B. Bicarbonate ions. The pleura surrounds the. The answer is C. Lungs. The normal arterial oxygen saturation in a healthy adult is generally. The answer is C. 95 to 100%. Surfactant in the lungs primarily. The answer is B. Reduces surface tension. The largest gland in the human body is. The answer is B. Liver. The largest part of the digestive tract is. The answer is B. Small intestine. The main site of nutrient absorption is. The answer is B. Small intestine. The first part of the small intestine is. The answer is C. Duodenum. The final part of the small intestine is. The answer is C. Ileum. Bile is produced by the. The answer is B. Liver. Bile is stored in the. The answer is B. Gallbladder. The enzyme in saliva that begins carbohydrate digestion is. The answer is B. Amylase. The enzyme that begins protein digestion in the stomach is. The answer is B. Pepsin. The acid present in the stomach is. The answer is B. Hydrochloric acid. The pancreas produces. The answer is B. Digestive enzymes and hormones. The hormone that stimulates gallbladder contraction is. The answer is C. Cholecystokinin. The finger-like projection in the small intestines are called. The answer is B. Villi. The main function of the largest intestine is. The answer is B. Water and electrolyte absorption. The vermiform appendix is attached to the answer is B. Cecum. The largest part of the brain is. The answer is B. Cerebrum. The part of the brain responsible mainly for balance and coordination is. The answer is B. Cerebellum. The vital center for respiration and cardiac activity are mainly located in the. The answer is B. Medulla oblongata. The master gland of the endocrine system is commonly called. The answer is B. Pituitary gland. The hypothalamus primarily helps regulate. Answer is B. Homeostasis. The spinal cord is protected by the. The answer is B. Vertebral column. The number of pairs of cranial nerve is. The answer is C. 12 pairs. The number of pairs of spinal nerve is. The answer is C. 31. The sympathetic nervous system is associated with. The answer is B. Fight or flight response. The parasympathetic nervous system is associated mainly with. The answer is B. Rest and digest. The organ responsible for hearing and balance is the. The answer is B. Ear. The sensory receptor for hearing is located in the. The answer is B. Cochlea. The organ responsible for vision is the. The answer is B. Eye. The photoreceptors of the eye are. The answer is A. Rods and cones. The part of the eye that controls the amount of light entering is the. The answer is B. Iris. The main function of the kidney is. The answer is B. Filtration and regulation of body fluids. The functional unit of the kidney is. The answer is C. Nephron. The process of filtration occurs mainly in the. The answer is B. Glomerulus. ADH primarily increase. The answer is B. Water reabsorption. That lowers blood glucose is. The answer is B. Insulin. Insulin is produced by. The answer is B. Beta cells of pancreas. Glucagon is produced by. The answer is A. Alpha cells. The thyroid gland primarily secretes. The answer is B. Thyroxine. The parathyroid hormone primarily increase. A. Blood calcium. The adrenaline medulla secretes. The answer is B. Adrenaline or noradrenaline. The hormone responsible for milk production is. The answer is B. Prolactin. The hormone responsible for milk ejection is. The answer is B. Oxytocin. The hormone responsible for ovulation is primarily. The answer is B. LH, luteinizing hormone. The normal pH of arterial blood is. The answer is B. 7.35 to 7.45. The universal donor for red blood cell transfusion is generally considered. The answer is C. O negative.